Now we'll move on to antifungal drugs. These are used for fungi or yeast infections, which may be systemic, such as histoplasmosis. They may be vaginal, such as candida, or they may affect the skin, such as tinea, which is ringworm. Amphotericin B, also known as fungazone, is the first drug in this category that I'll cover. This one is used for the treatment of systemic fungal infections, such as histoplasmosis or coccidioidomycosis. Adverse effects include blood dyscrasia, which basically means like a disease or dysfunction of the blood. So you're going to want a CBC count done weekly to check for the levels of blood cells and make sure everything is the way it's supposed to be. You're going to want to give aspirin, acetaminophen, Benadryl, and steroids prior to the infusion of this drug, just to prevent any problems that may happen. You're also going to want to watch for abnormal renal function, because hypokalemia and azotemia are common. IV infusion for this drug should be done slowly to prevent adverse reactions, and don't ever mix antibiotics with fungazone. You just don't do it. Fluvoxin, another drug, is used for the treatment of ringworm infections of the skin, hair, and nails. This is a penicillin derivative, so if a patient has an allergy to penicillin, you wouldn't want to give this drug. You're going to want to have the patient avoid sunlight, because intense sunlight may cause redness and rash. Also, oral preparations are most effectively absorbed and cause the least GI distress when given with a high-fat meal. Finally, there's Lamisil. This is used to treat fungal infections that are either topical, and then also for fungal nail infections, which you can give by mouth. And the only major adverse effect of Lamisil is that it may cause liver damage, so you're going to want to watch for that. There are antifungal drugs, which are, I guess, could be known as azole antifungals. These are all antifungal drugs that have azole, A-Z-O-L-E, at the end of the generic name, such as ketoconazole and fluconazole. You can see the 4 examples I listed. These are used to treat a wide variety of systemic fungal infections. Adverse effects include, the fact that these drugs may cause nausea or headaches, and they may increase liver function tests, but generally are well tolerated. So just keep an eye on things. These drugs may also increase the blood thinning effects of Coumadin. So if a patient is needing to take this drug, make sure that they're, check to see if they're on, warfarin, aka Coumadin, and then you just, weigh the balances of whether or not this is a good idea, or just at least keep an eye on the PT of the patient. Another antifungal is nystatin, also known as mycostatin. These are used to treat gastrointestinal and vaginal yeast infections. Adverse effects include, for the most part, oral use of these drugs are usually not toxic, but tell a patient to take medication for 2 weeks after the symptoms improve to prevent reinfection. And you're going to want to teach patients about predisposing factors for vaginal infections, so that this doesn't happen again. Also, chloromazole and miconazole. These are vaginal suppositories. They're available without prescription for vaginal yeast infections, so that might be a good cost-effective way of helping a patient with a yeast infection. The last drug category I'm going to cover in this video are anthelmintics. These are used to rid the body of parasitic worms, such as tapeworms, pinworms, hookworms, roundworms, and schistosomes. These drugs affect various systems within the worm, causing it to die. So depending on the drug is, depending on, how the darn little thing dies. So, hallelujah for how it works. Examples, I have two here. One is atrobrine. This is used to treat giardiasis, malaria, and tapeworms. One thing you're going to want to watch for with this drug, it's just a common side effect, so let your patient know, is that it can color the urine a deep yellow. So if they're on this drug, they shouldn't be alarmed if they get a deep yellow urine. Also, Vermox treats roundworm, whipworm, and hookworm. Adverse effects, usually these are relatively non-toxic drugs, but you're going to want to teach patients and family about how the worm is spread so that they don't spread it, essentially, because it's always easier to kill it the first time around and not have to revisit the situation.